So this screen here is essentially a snapshot of everything that's going on with the patient clinically and from a lab standpoint as well. What it allows us to do is several different things. Everything from vital signs to laboratory values, everything is right here at a single viewpoint. You'll notice that the numerical values are actually color-coded as they help us to identify particularly concerning lab values and vital signs. So that it helps us improve rapid response options, things like respiratory failure and sepsis. Also helps identify critical changes in laboratory values, and it helps us, it gives us a snapshot of the patient, everything that's going on. It gives us kind of a remote monitoring capability so that we can intervene on the patient's behalf in any way that is deemed necessary. So it's really nice to have, you're able to see the patient and the laboratory values all at the same snapshot. Just by quickly walking in the room, you can know exactly what's going on with the patient and determine clinical status and safety. The cross-section of intensive care medicine and patient safety, clinicians are having to deal with literally thousands of points of data, hour to hour, shift to shift. And it's just not humanly possible to integrate that on a consistent basis 100% of the time for every single patient. So right over my shoulder is the screen that gives us essentially remote monitoring of every ICU patient in the hospital. I can literally look in one of the largest ICUs that we have in the entire hospital. I can see every patient in aggregate in this screen. And if I see one of these red alerts, I simply can click on that screen, and it helps me do a deep dive on the patient and what exactly the parameters are that are concerning. This again gives us an overall snapshot of the threats the patient may be facing, but it also helps us do a deep dive on any particular areas of concern. A tool like this is so critical to help us boil it down to just the essential elements. What is going to help my patient get better, but what's also going to help them from being exposed to safety events, decompensation.
Hi, my name is Eden.
I'm Christine.
And we are part of the rapid response team at the hospital.
We're monitoring patients in our office right now. We're doing everything remotely, monitoring the whole hospital. For example, this patient 7B is alerting us right now. You see in red, respirations are 34. That's a big flag. And this enables us to see what's going on, getting a bigger picture. We can also monitor all the patients in the hospital.
Hi, I'm Pat Hurley. I'm Chief of Critical Care at Baylor St. Luke's Medical Center, but as I always say, I'm more labor than management. So I'm working in one of the ICUs right now, the CV recovery room specifically. I took a little break after rounds, come up to my office. I'm managing my email flow and administrative tasks on my Baylor computer. And over here, this is my St. Luke's computer, and as you can see, I've pulled up the CV recovery room. Each of these boxes is one of the patients downstairs. These boxes are colored red, green, and yellow to help me manage safety issues, alarm level issues, and really to keep track of the progress of my individual patients down there. I look at any one of these patients more specifically and track their progress or their specific data. As you can see, I can click right in, pull right up, and watch what's happening. I am mobile with my Decisio program and platform, watching my patients live time. I just got an alert through the Decisio platform. I am looking at the data live time while I'm headed to my ICU to manage. In addition to being able to get into our patient database and watch them live time remotely, the Decisio platform is built with alarms that get pushed through a texting platform to critical providers on the team. So respiratory therapy, if it's a ventilator issue, our sepsis ICU nursing team, if it's a new onset sepsis in the ICU. So that's what we're doing, and hopefully that helped.